Now we're talking to the lovely Naomi Fitzgibbon, who is Director of Nursing at the Irish Motor Neurone Disease Ireland, and you're very, very welcome to Disability Matters.
Thank you very much for asking me on.
It's our pleasure. Now you might start by telling us a bit about about motor neurons disease, what it is and how it affects you.
Absolutely. Motor neurone disease is a disease that is uncommon. There are at the moment about 480 people living with motor neurone disease in Ireland, and that would be similar to, I suppose, across Europe. And what happens is that the neurons that we have in our body, which we need to do everything, to blink, to breathe, to eat, to think, they stop working. And when they stop working, the body stops working, unfortunately. Right. And that's the simplified version of what's going on. Right. It's a very complex disease, and there are different types of motor neuron disease. But to put it simply, people will experience different weaknesses. Maybe it could be in your legs or in your arms. People can get a slowness in their speech, or maybe their swallow could be affected. And what happens a lot of time is that people are going to their doctor because it mightn't be anything too serious at the moment, and they might end up going to different doctors or to physiotherapists or to various different doctors. And then eventually, as the disease progresses, it becomes a little bit more obvious that there's something serious going on. Right. And that's when the person ends up with a neurologist who will then do some tests to outrule other diseases, but to find out if it is motor neuron disease.
I get you. Now you say that there's about 450 people with motor neurons in Ireland.
Yeah.
Do we know the gender split? Is it 50-50?
It's more men than women. Okay. It's about 65-70% are men with motor neuron disease, and then obviously the other are women. The age group is over the age of 70, so it would be considered to be a disease of older age, but also there are younger people who do get motor neuron disease.
Do you know, is there a reason why you get it? Is it something in the body that points to it, or?
We don't know yet. There's a huge amount of research being done at the moment, and we're very lucky that we have Professor Orla Hardiman in Beaumont Hospital, who's doing phenomenal research, and she's working with European teams and across the world, US, to try and find the causes and also to try and find treatments as well. So it's a very, very difficult disease to try and find one cause. There probably isn't one cause. There's probably many factors that are contributing to it. It can be hereditary. Some people will have a specific gene that would indicate that they could get motor neuron disease, but there's different genes. And then there's genes that they don't know what's going on with as well. So it is very complex.
So you may get it from a parent or further, but you may not.
Absolutely.
Is the answer, really?
Yeah, just because you carry the gene doesn't mean that you'd get it.
Oh, I get
it. But it increases your risk of getting it.
And do you know how many additional cases there are every year?
Roughly, there are around 150 a year. Yeah, so it is, but it's a small number compared to other diseases. Yeah. And that's why they need a huge amount of support from the likes of us, from the Irish Motor Neurone Disease, because we're the only ones providing that kind of support nationally with our nursing team and our support team.
I'm shocked by that number now. I thought it was in the teens or less.
No, that's about it. Yeah, and it's slowly increasing, but not dramatically.
You said there's various types of motor neurons. I won't ask you to go into them all, but what I will ask you is, do they have the same type of symptoms?
There's kind of three kind of main symptoms or types, and they would be categorized by people who get maybe a weakness in their lower limbs. First of all, they present maybe with they're a little bit of weakness or a drop foot, or they're tripping or falling. People who get symptoms in their upper limbs or in their arms, and they might get maybe a twitch in their hand or a bit of hand weakness. Or then people will get problems with their speech or slurring or swallowing. So they would be the kind of, to put it simply, the main kind of groups as well. And it's not to say that anyone who gets a bit of, foot drop or arm weakness or something with their swallow or speech is that it absolutely means that people have MND. There's a lot of other factors that come into it, but they are some of the different types.
Yeah. I read about Kennedy syndrome, and that seems to be a little bit different from the others.
Yeah, it comes under the umbrella of motor neuron disease, or ALS as they call it in the States. And it's not as progressive as some other types, but it still comes under the umbrella of motor neuron disease.
Yeah. Now, if I was diagnosed today, would I be referred automatically to IMNDA?
Yep.
Oh, very good.
But pretty much the doctors who are working in neurology around the country would know of the Irish Motor Neurone Disease. So they would tell people to get in touch with us, or it could be one of their other healthcare providers, maybe a nurse or a physio or whoever it is in the team. And generally, most people will get in touch fairly quickly as soon as they're diagnosed.
That's good. Yeah, I asked that question on most interviews, particularly with issues that can, let's call it, degenerate over time. And people are getting into the mindset of asking doctors and physicians and consultants to refer automatically, which makes sense.
Yeah, and they do, and they're very good at doing that because they know that the person needs a lot of support. So the sooner that we're able to get in and support them, the better for the family and the patient.
And a diagnosis is a huge thing, and it's a huge thing for the full family. Assuming I was the person, and hopefully I will not be, who was diagnosed, what advice would you give?
For you and your family, I mean, the most important thing is that you're connected in with the Irish Motor Neurone Disease Association, and that you also have been referred to Beaumont Hospital, because that's the centre for neurology and particularly looking after motor neuron disease in Ireland, as well as CUH in Cork as well. So it would be important that you're linked in there because that's where the clinical trials happen and the genetic testing happens. So that's very important. And you'll get to meet what they call the multidisciplinary team from the very, very outset. That's the most important thing. And then the next thing is that our nurses will contact you and arrange a time to come and meet you in your home if that's what suits you. And then once the nurse comes out to meet you, you'll have a chat with her and to see what are the needs that you have. And from there on, that nurse will link in with you throughout your whole journey. So it's very much individual care on what you need, because everybody is different. There's no two people with MND who are the same. So it's very much based on you, where you're at the moment, and trying to predict what supports you're going to need in the future, and as well as supporting the family as well.
And when you say a multidisciplinary team, who are we talking about?
So that would be a physiotherapist, an occupational therapist, speech and language therapist, a dietitian, nurses, the doctors, and psychological support as well. That's kind of the main team, and then there's other people within that team who support, but they're the main ones.
Right. And is there a treatment regime, or does it include diet changes and all that type of stuff?
Well, it's really down to the individual. So each of these specialists in the multidisciplinary team will be looking at the person as a whole to see what do they need. So how is their diet? What weight are they? How is their walking? How is their limb movement? What supports do they need? Speech and language will be looking at swallow. How is your speech? So each individual in the MDT will be looking at the person and suggesting what care needs to happen.
Yeah. That's really important, isn't it?
Oh, it's really, really important. It is.
Yeah. Now, if we get on to the Irish Motor Neurone Disease Association. Can you tell us a bit about the history of that?
Yeah, so the organization is 41 years old now this year. And last year was a big celebration, 40 years of existence. And the organization was put together by a group of people who had MND, Professor Hordiichuk, and a few other friends who got together, started the organization with a few people. And now today, 41 years on, we have 20 staff. We have a team of 7 nurses. We have an equipment team, healthcare professionals who are working every day to support people with equipment that we have on a loan basis. And then we have a fundraising team, which is our very important team as well, a communication team and advocacy as well.
I'd imagine without the fundraising team, you may not be.
Very important. We only get a small amount of money. 15% of our funds come from the HSE, which is a very small amount. And without the community who support us, and that is the Irish community, they're phenomenally supportive, we wouldn't be able to do the work that we do. We wouldn't be able to support people the way we can.
Sorry for interjecting there. What services do you provide? I know there's a lot involved here now.
Yeah, there are, and it's all tailored to the individuals, and it's the research that we've done is on what people tell us that they need, and then we provide the support. So I think the main first port of call for patients and their families is the nursing service. So we have 7 nurses, and they are around the country in the different regions.
Good.
And they're supported by the equipment and service team and information support. So as people need equipment that is maybe not available quickly enough from the HSE, we're able to provide that. We have also some grants for people who need psychological support. Maybe it's counselling, additional physiotherapy, travel support, and we have home care grant as well. So we top up the HSE to help people stay in their home and stay safe in their home. There is small grants as well that are available for people on an individual basis.
That bit of independent living is really important to people, I would imagine.
It is, and people don't want to be in hospital. They want to be at home.
Yeah.
They want to be surrounded by the equipment that they need, and they want to stay as independent and at home for as long as possible.
Yeah. And how do you approach a person who lives on their own?
Well, we approach it as we would anybody, what their needs are, and we'll try and support them. And we will try get with the supports that they need, but also linking in with the local community. Like, we're not doing this on our own. We have to link in with all the healthcare providers and local community support systems that are there, and get them linked in with the local community support, because that's really important. We can't do this on our own.
Absolutely. Now, your website says that you provide information to healthcare professionals. Is that outside of your organisation?
Yeah, absolutely. So motor neurone disease is an uncommon disease. And so a lot of healthcare professionals may not even come across somebody with motor neurone disease, maybe only once in their career.
Right.
So when they do meet somebody with motor neurone disease, they're not really very au fait with how to support them. So we will come and we do education within the community, in different hospitals, in nursing homes, and we're constantly educating healthcare professionals. So it's something that's very important, because they don't know where to turn for the information.
Now, I presume research is extremely important.
It is. And we fund research. We support Professor Hordiichuk. We provide some funding to her so that she can carry out her fundraising. But we're starting to do our own quality of life fundraising as well to see. And that's really around what people need and how we can support them within that.
Now, you're talking about fundraising. Have you anything going on right now or in the near future?
The campaign that we have at the moment is the 40K Your Way in May. And that is where people can run, walk, be active, crawl, whatever they can do, play football or whatever, 40 games, and get a team together and raising vital funds for the organization. So that's happening at the moment. There's some amazing activities going on. If anybody needs any information, if they have a look at the website, which is www.imnda.ie.
Very good. Can the public get involved in the organisation, or can they help in any way?
Well, they can. I mean, if they know anybody who has motor neuron disease and that they need support, and maybe they're not linked in with us, is that they do connect in with us, and they advise people to contact us. We'll get back in touch with them. And if they do want to do any fundraising, if they can go onto the website and have a look at our website and see what fundraising activities they can get involved in. And also there's a lot of people who are running the mini marathon for us at the moment, which is just phenomenal. It's just great. So people are just so generous with their time and so innovative when it comes to thinking of different ways of raising funds for us as well. It's people have done incredible cycles and hill climbs and marathon running, and it's just, it's phenomenal, and we really appreciate it. We wouldn't be able to do our work without them.
I'd imagine the feel good factor is around at that stage.
It is. Yeah,
brilliant.
Absolutely.
And we're right at the end of the interview. You'd be glad to know. Is there anything else you'd like to throw out there before we go?
Well, I think the most important thing is that, we are here to support the patients and their families. So if anybody is not connected with us, to get in touch with us, and we will support them and link them in with the appropriate care needs that is, appropriate for them. And to thank all of our community who are out there raising funds for us. They're just phenomenal.
Your website is fantastic. It's full of information and very easy to use. And I would certainly recommend people go and look at it, because the information there would be very useful. If I had a family member who had motor neurons or anything like that, that's where I'd be going. So before you go, just throw the website address out again.
Yeah, it's www.imnda.ie.
Great. Naomi, thanks for talking to us at Disability Matters.
You're very welcome. Thank you.
It's
Thank
our
you again.
pleasure.